A lot of these jobs are not promoted because they don't want you to know about them. They want you to keep breaking your back at the bedside. They want you to keep getting underpaid. This is a business and they treat it as such. The question is, are you going to do the same? What is up, you guys? Welcome and welcome back to the channel. For those of you who are new, my name is Kiara Selena, and on this channel, we talk about nursing, beauty, content creation, and lifestyle. I did not expect the video that I posted a few days ago to go as viral as it did, and on that video, I got so many different questions, which inspired this video. A lot of nurses out there absolutely love being a nurse and they love the impact that they can have on the lives of other people, but they absolutely hate the bedside. A lot of nurses have gotten their experience and they are sick and tired. They're ready to go. And in this video, I'm here to talk to you guys about 5 nursing jobs that you most likely have never heard of. Before we start, if you are a bedside nurse and you are ready to walk away from the bedside, let me know what specialty you've worked in, how long you've been a nurse down below, and why you want to get away from the bedside. Without further ado, let's get straight into the video. So the first nursing job I'm going to be talking about today is the nurse who works in nursing informatics. This is actually something that is brand new to me and that I actually just learned about yesterday on my live. There was a nurse who works in informatics. She is an LPN and she said that she transitioned into tech fully, so I had to go ahead and do my research. A nurse who works in nursing informatics basically works closely with the tech and development team. All of the systems that we use in the medical field, both as nurses and doctors, are Epic, are EMR, Pyxis, eMeds, Meditech. All of these systems were created by the tech and development team, and you best believe there was a nurse by their side when they were doing so. As an informatics nurse, you are going to be helping with system implementation, system analysis, and basically just working alongside the tech team to go over the systems that they're developing for us and giving them our input from a medical or nursing standpoint. Of course, you can hire a bunch of tech guys and girls to develop a system for nurses, but what makes it a little bit tricky is that they can't see things from our point of view. So you're able to analyze these systems, use these systems, watch other nurses use the system, and basically give your input on the things that can be improved to help with patient safety, proper charting, and basically just ensuring smooth usage for the nurse and proper patient care for the patient. So this is a really unique way to use your experience as a nurse and still have an impact on the healthcare system as a whole. Some places may require you to have a certificate, a bachelor's degree, or a master's degree in nursing informatics to work with them. But from what I've heard from not only the nursing informatic nurse that was on my live, but also a lot of the other nursing informatic nurses that I've seen here on YouTube, your experience is what they deem the most valuable. The next nurse that I want to talk about is the legal nurse consultant. And I've known about this for a while, but I still don't think that it's spoken about enough. Just like it says in the name, we know that these legal nurse consultants work closely with paralegals, legal assistants, and attorneys. A lot of the times they're going to help in malpractice cases or cases surrounding the healthcare system. And they're basically there to help the attorneys get a better understanding when it comes to reading legal documents and basically giving their perspective on how things should be done medically in legal medical cases. So if you guys watched the video about me getting my nursing license suspended, I'm gonna leave that video down below if you're interested in watching it after watching this video. In that case, there was a committee that went over my file that consists of HR people, legal professionals, and legal nurse consultants to basically go over all of the documentation that was provided pertaining to the case. And these legal nurse consultants are basically there just to make sure that the rest of the committee has a proper understanding of how things are supposed to be done and the legal documentation that was provided. And because of the terminology and jargon that is used, sometimes it can be hard for these non-medical professionals to understand these documents. So they're kind of there to oversee everything and just to make sure that the outcome is fair for everyone. If you're enjoying this video so far and you find this information valuable, go ahead and like the video and don't forget to subscribe if you haven't already. Let's go ahead and get into the third nurse. The next type of nurse we're going to be talking about today is the cruise ship nurse. And this one is a little interesting. So just like the name sounds, it is a nurse who works on a cruise ship. A lot of you guys may not know this, but there are doctors and nurses present on cruise ships when you go on your cruise. For the most part, cruises are great experiences and things can go smoothly, but things can definitely go wrong and you can have some medical emergencies on a cruise ship as well, of course. You can have all types of things that can happen on a cruise ship. And in that situation, situation, you need to have some medical professionals on board in order to be able to handle that situation. So the cruise ship nurses and doctors are there to handle situations from minor to severe until the cruise ship can get to shore and those patients can be transferred to a proper hospital. But apparently these cruise ships have ORs, medical offices. So if you're a cruise ship nurse, please let me know what that experience has been like and what it's like for you to be a cruise ship nurse. I've heard that the cruise ship nurses can take advantages of the same benefits that the captains and the doctors can take advantage of. They can eat at all the restaurants, can benefit from all of the amenities that the cruise ship has to offer. They also get single cabins, meaning that they have their own single room just for them that they can enjoy. Ensure that the experience is as smooth and as enjoyable as possible for them. The third nursing job that is not spoken about often is the virtual nurse. Similarly to a triage nurse that you would see if you went to the ER or urgent care, that nurse is going to see you and assess you in person, and if it is not an urgent matter, you will be sent back home with certain devices that the virtual nurse can use to monitor you while you are at home. As the virtual nurse, you're going to be monitoring symptoms, vital signs, you're going to be asking questions, and you're basically going to be triaging your patients virtually from home, from a computer, and if not home, maybe in some type of facility. Correct me if I'm wrong. If you're a virtual nurse, leave a comment down below. And you're basically going to ensure proper priorities. So you're going to make sure that the patients that you are monitoring are being seen in the correct order based on the severity of whatever issue they have or whatever symptoms they're presenting. And lastly, we have the holistic nurse. And one of my good friends is actually getting her certificate as an RN in holistic nursing. If you guys want me to bring her up on here to talk a little bit more about that, please go ahead and let me know down in the comments. But from what I understand, a holistic nurse is once again exactly what it sounds like. Instead of just looking at things from these are your symptoms, this is a diagnosis, and this is the medication we're gonna give you, they look at things a little bit more holistically. This means going over some of the stressors or the things that you may have been going through during the time or right before your diagnosis or the presentation of your symptoms, going over things like meditations, chakra alignment, exercises such as breathing exercises or even physical exercises that you can implement to help you deal with certain symptoms without having to automatically go towards medication, and basically just a more holistic approach to nursing. This doesn't mean that they're going to be discouraging you from taking your medications, especially if it's something that absolutely requires it, but they're there to basically teach you some holistic methods that you can implement while taking your medications so that you're not just tackling the symptoms, which is what most medications tend to do. They don't really help with the solution of the issue. They just help with the symptoms of the issue. Holistic medicine is going to help you get to the root of the issue so that you can tackle that while tackling the symptoms with your medications. I hope I explained that properly. Give me a thumbs up if I did. So these are the 5 nursing professions that you have probably never heard of. Let me know if you've heard of any down below, or if there are any mistakes that I made that you want to correct. Let me know if you're interested in a part 2. Don't forget to like and share if you haven't already, and check out these 2 videos right here. You might like them.